Greetings everyone, this is Timothy, the Digital Apothecary, and I want to talk about an article I wrote a few months back, and something that's been on my mind for quite some time in terms of how could we make a pharmacist into a digital health coach. So I'm going to talk about my idea, and I'll leave it out there and we'll welcome some feedback on this, to be quite honest. So this is the article, and I titled it basically, how do we make a digital pharmacist? I'll put the link below, and you can always click on it if you want to read more in depth. But the reasons why I thought this was something that was a good focus was the rise of digital medicines and basically digital therapeutics. So digital medicines would be talking about smart pills, smart inhalers, smart insulin pens that are coming to the market. And then also digital therapeutics are the idea of prescribable apps and services that basically can be used as well to be adjunctively used in care. So in another video I talked about CVS partnering up with Big Health, Sleepio for help for sleep. And then the other option I think is remote patient monitoring. Remote patient monitoring I think is very big because the Center for Medicaid Services and Medicare basically expanded this whole billing process to help out with monitoring patients remotely through different devices. So they have like a Bluetooth blood pressure cuff. Could you monitor how their blood pressure is, and that help my guide in terms of changes in therapy, or for making sure there's no adverse reactions associated, such as like hypotension with medications. And there's a bunch of other new technologies of interest, I think, too. So what I came up with was this framework here. So what I thought would be interesting is if you had a digital pharmacist. So what would it be, a digital pharmacist? What I think is that, first off, how do you get there? First, you need to be trained on digital health topics. That can come different ways. Like, you could have a organization that backs this up. Would this be like APHA, ASHP? Would this be a school certificate program? Would this be formal training? Would this be a master's? I don't know. To be honest, I really don't know how to best go about this. I think it can be very informal at this current time before it becomes very standard. I mean, this is not even an area for ACPE for accreditation purposes about what is standards, and it's such a brand new area. So it's kind of a nice thing because I think it offers a good opportunity for people to become self-trained. But then I think any organization that wants to implement digital health has to also supply their own training based on their own organization pursuits. So like if CVS Health Hub turned into a place where pharmacists could provide information on digital health, like what products CVS has, and stuff like that, and that would then turn to on-hands training for it and what they need to know. Is this include, like, okay, let's suppose you did remote patient monitoring and you were assessing adherence for a disease, like what platform you're using, what software, being able to do it. Now, if you had a digital pharmacist, where would they work and what would they do? This, I think, is kind of cool because I could envision, if this takes off at some point, that you could have pharmacists at different locales, areas that would be responsible for it. Maybe if we were talking like in the community setting for like a big chain, you could have a digital pharmacist in each district that was responsible for training the other pharmacists on new advancements or new stuff that comes out. And they could help out with rollouts and such. And that kind of leads into these three areas I think are key: being a pharmaceutical company contact, company trainer, and a patient representative. So let's talk about pharmaceutical companies, or even like startups or things like that. So like if we were talking about a digital therapeutic app that helps out with insulin dosing, for instance, like Volantis Insulia, or maybe a substance use disorder such as Therapeutics, Reset, then you could basically look at this and say, okay, you need training on how to use that technology. Or if it's like a smart inhaler, how to use it and such. So you kind of like be a liaison with pharmaceutical companies or startups, be trained on their platform, be trained on their devices, be an intermediary. So if there's recalls, there's updates, firmware, stuff like that, just so everyone's aware of it, and you're always be aware of any changes. So the pharmacist would basically be the contact person, and they'd be really responsible for understanding everything that's going on, maybe setting up educational guides and such for internally in their company, and kind of putting out more, I think from that training standpoint, and just being that person that would know the most. And then they could be a company trainer. You could train other pharmacists, maybe even technicians. You would make the training material that's used internally. Be a contact person for the pharmacists that have questions related to the technology, create workshops and webinars, looking at basically how they make the billing and how to make a profit from it. So I think that'd be like the biggest role for a digital pharmacist, either hospital or community setting or anywhere else that integrates with the digital health service or platform. And then along with that is a patient representative. Like these would be the people that would also be responsible for maybe teaching patients, or at least if patients have questions in more particular. They can also help drive community engagement. You already see that with like vaccination programs and such, putting this stuff out there, and then help relay patient concerns back to the company that they work for, or even for the pharmaceutical or the tech company itself. So this is my idea. Is basically this is the digital pharmacist would be like a digital health coach, which doesn't really exist at this current time. I think this person will need some very interesting training levels, because there's some soft skills associated with this in terms of like how to be a liaison, contact, work with maybe other representatives, or talk to medical science liaisons from pharma or from whatever the version is going to be for tech companies. But they're also going to have to working with internally for their own organization. But I could also see, in terms of also having to be hands-on in terms of like if they're integrating with software or that's going to be used by other pharmacists that are going to work directly with patients as well. They probably have to have some knowledge, so maybe some data analytic knowledge in terms of like seeing like how well this works out. Maybe some understanding of like payers and reimbursement models and such that goes into it. Programming, possibly programming knowledge as well. So there's got to be some tech background there, and I think that'd be kind of cool. And I think this is a type of person that might be needed in terms of basically drive the digital health awareness and this proposition across the industry, because I don't think this really exists at this current time, and I think it's something that will have to grow substantially. I've been an advocate for pharma and startups to really consider pharmacists as this type of person that they should be utilizing to help basically deliver this level of care to patients just beyond physicians at this current time prescribing and just rolling out. I think pharmacists can play a big role for it, just because we have the space and the resources as well, and we are directly facing with patients. After all, even if the prescriptions received by a patient from a physician saying you have to go buy this, if the pharmacy starts stocking as well, they're going to come to us and buy it. So it might as well be us to help set it up and everything. So yeah, contemplating this though really leads to a conundrum though, is how are you going to pay these people? What value proposition do they add to an organization? I think there's not that opportunity for a huge amount of this type of digital pharmacist that would do all these roles. I think it's be a very selective group up front, just to bring awareness to other pharmacists that are working in the field and directly interacting with the patients. But I think this is something that I think at this current time, especially if like maybe you're a founder as well and listening in to this and watching this, or even work in pharma and you're wondering about how to get your products out, I think this might be an avenue that needs to be gone and pursued. I think it also needs backing though from some organizations for the training to really set up and kind of formalize this pattern. Otherwise, I think it would turn into a very fragmented mess. Like you'd have all these different people doing all these different things, which I think would make things frustrating overall, because you want to really have clear terminology, clear understanding. It's not like bouncing from one company to another company and finding out that they do completely different things. So I think a standard approach needs to be developed. I think someone needs to take the reign on that at some point. Do we have to go down the certificate path like MTM and everything else? I hate to see that as something that becomes mandatory. But I could also see that's just going to be something that has to be done, at least in the short term, just to get people and say, okay, this person knows what they're understanding about or has a clear understanding of this field. But that's basically the premise. In any event, just a quick little concept. Welcome your comments or any other advice you think. I'd love to explore this further. So this is Timothy Young's the Digital Apothecary, and take care. Have a good day.